It's just amazing what's out there. Anyway, great to be with you with so many friends in Atlantic Canada, Northern Maine, Eastern Maine. I've done a number of these today, and it's been very fascinating, very interesting. The last one I was on actually had the son of Jonas Salk, Peter Salk, and it was interesting to see him and to think about the heritage of his father with the vaccine that started all of this 65 years ago and made polio eradication possible. I want to thank Governor John for inviting me. I first met John at a Rotary Leadership Institute session, Stellar as well, in the same way. And I kind of knew he might be a governor someday, Stellar and others of you, Harriet and others. So it's just wonderful to be with you. So what I want to do is, if I can share my screen. This is good. You have me enabled. I'm impressed. Sometimes it doesn't work so well. This time it is. So what I want to do is give you a little overview of where we are with the eradication of polio, and particularly how we're going to get it done. Because I think a lot of people wonder, what's the end game? What's the hopes of getting it done soon? Because I've been at it so long. First of all, I want to touch a little bit on World Polio Day. This was in Lahore, Pakistan yesterday. John's counterpart as district governor is right there front and center. He led a polio walk on the streets there in Lahore. This was today in Jalalabad, Afghanistan. They had a polio training session, and you can see all of these different folks who were using the this close signal. This is the governor of Khyber Pakhtunkhwa, which is a Pakistani province that's right on the Afghanistan border. And on the Afghani side is a place called Nangarhar. And both governors met today for the express purpose of expressing cooperation and working together to win polio. And these things don't happen. And to see it happen, particularly today, is so important. This was last night in Abu Dhabi, in the United Arab Emirates. And it's some building that has something to do with Formula One. I'm not sure exactly what, but I was actually in Abu Dhabi last November, at which different countries pledged money to end polio, including the United Arab Emirates, where Abu Dhabi is. This was this morning in Bangladesh. Actually attended a meeting this morning in Bangladesh, and I actually found this photo online on Facebook of the Rotarians there had been out on the streets of Naranyaha, whatever it was, Yanga. I didn't pronounce it to them. Doing things. This was in Pennsylvania. They had a polio event there, some sort of a virtual walk. But anyway, back to polio directly. This is a poorly taken picture, but I took it. This is a lab in Borno, which is a state in Nigeria. It was in this very room that the last wild polio virus case in Africa was discovered. There was a child who lived nearby, and they brought a stool sample to this lab. They tested it, and there was the wild polio virus 4 years ago. And since then, there haven't been any. These are our polio vaccinators, our community-based vaccinators in that same community. This is actually right across from the lab. And they're all polio survivors. They're people we pay small stipends to, and they're the ones that deliver the polio vaccines. I know a number of you have been on National Immunization Days, and that's wonderful. It provides great support and encouragement, but 99% or more of the vaccines are actually delivered by individuals like these, people who live in the communities, who identify with the communities. And you can see a lot of them have mobility issues. The tricycles, which are those things that you see the wheels in the back, they wanted new ones. And our polio chair for Nigeria was there with me when we visited. This was actually back in 2017. And they said, we want new ones. And okay. So I looked at Tunji, and the logistics would be the responsibility of the Nigerian PolioPlus committee. And I said, yeah, we'll pay for them. To be able to say that is only because of you folks, only because you gave donations to PolioPlus. And, we gave these folks dignity. We're also allowing them to continue to work to help their neighbors, help the children in their community end polio. This is the area that they work. This is a camp for internally displaced people. Again, this was the community where Boko Haram was founded, the terrorist group. They go up and down these alleyways. 60,000 people escaped Boko Haram to live in this particular village. This is the deputy governor of that state. This is in that village. He took us there, and we dedicated a well so that people had clean, safe drinking water. And it was paid for, again, by PolioPlus, the Plus in PolioPlus funds. It's a way of enlisting support in this area, but also in helping to improve health and sanitation to lessen the possibility of polio. If you look to the far right and back of me, there's a man there in a uniform. There were 17 men protecting us with assault weapons while we're there. Actually, I think they were actually protecting the deputy governor. I don't know if they cared about us, but anyway, they were protecting the deputy governor. And the deputy governor, I was in his vehicle leaving, thankfully, because he told us that the day before there were 3 people who had been killed by a suicide bomber at the entrance to this camp. So when you think back to the other picture of those polio workers, I was able to only stay there 20 minutes when they gave the let's move signal. But those polio workers go back there every day and continue to immunize kids. This was a slum, they call it, although I hate that term. This was a village outside of Abuja. And the man in black, that's Tunji Funcho. Tunji's a Rotarian. He was he is our polio chair in Nigeria. And Time magazine named him 2 weeks ago as one of the 100 most influential people in the world. That's what polio eradication means. It's, sometimes we think, Rotary doesn't get credit. Well, Time magazine, time.com gave Rotary credit, and Tunji, just a wonderful guy, good friend. And he didn't really like the water in the well we were dedicating here, looking at his face. But, I managed to drink it and survive to live another day. And, all these people look pretty happy. Some might wonder, what about women? And, they were standing alongside. And this particular village, the men stand in one place and the women stand in the other, except for Carol Pandak, who works for Rotary, and one other woman who works for WHO. These are our polio vaccinators in Afghanistan. This was World Polio Day 2 years ago. It's we're so dependent on these community-based folks who the mothers and fathers identify with. Here they had come together for some training. And I've never visited Afghanistan, obviously, with security reasons. It's not the safest place to go. But, this is who we rely on. Again, it's not safe. Every vaccination that we do through our partners, through those community-based vaccinators, they're accompanied by a man like the one you see in the back here. They're not paid for by polio dollars. They're paid for by the governments there. But, security is important. But, it's the reason they're there is because what's in the foreground of the picture. There is as a polio worker, putting those 2 drops into that little boy's mouth. And, that kid won't get polio, and we ought to feel good about that. So, Rotarians, we've been at this now for, you can look at it since 85, 35 years, but you can also look back to the Philippines in 1979. And, people often hear, well, there was a goal of 120 million the first campaign, and then, we raised 240. Well, the reality is, there's been a lot of time since that, and, Rotarians have continued to be generous and to give, and it's now over $1.1 billion. And you say, well, that's a lot of money, but yeah, it's over 35 years. It's 36,000 clubs we have. So everything that every club does is important. My own club has polio cans on the table. People put their spare change in them, and it adds up. You do something with 35,000 clubs. Eventually you meet your goals. The Gates Foundation, they're still matching 2 to 1. They've been doing that since 2006-07, and that's now $980 million US that they've given to Rotary. And they don't tell us how to spend it. Yeah, it needs to go to WHO and UNICEF, but we decide what countries, we decide what programs, all of those different things, as we do for the Rotarian donated monies. It was Rotary that brought the Gates Foundation into the partnership. It first came through Bill Gates Sr. And the Bill and Melinda Gates Foundation is now the #1 giver to polio eradication. And they have spent over $4 billion. But $1 billion of it, they've entrusted to Rotary. And I think that says something. They trust us on how we spend the money and advocate. We also try to convince governments. And I know a few of you from the US. The US is the #2 giver after the Gates Foundation. Rotary is 3. But look at Canada here, $630 million US. That's a lot of money. And every government is, I've met Stephen Harper, I've met Paul Martin. I had the opportunity to meet Prime Minister Trudeau. Actually had an extended conversation a couple of years ago with Chrystia Freeman, who's the Deputy Prime Minister. And, Canada's just been terrific. They were the first government to actually give money. So all the Canadians ought to be proud. So what's our impact? That's money. There are 19 million people who otherwise would be paralyzed or not with us if it wasn't for Rotary having the vision to begin this program and to invite other partners alongside. We've immunized 3 billion children. Just think of the logistics. Think of the making of the vaccines, the getting it in place, the convincing of the parents to convince parents of 3 billion children to receive the oral polio vaccine. Last year alone, 430 million children, 40 countries. We still need to immunize as long as there's polio anyway. We see that with the coronavirus. It's a plane ride away, and polio is no different. For wild polio virus, 4 years was the last case in Nigeria. Before that, it was 6 years in Somalia. Other than that, every wild polio virus case has been in Pakistan and Afghanistan. So far this year, there's about 132. Pakistan has 1 more case than they had at this time last year. Unfortunately, Afghanistan's gone from 18 to 52. The reason with that is that some areas have been inaccessible because of anti-government elements, the Taliban, ISIS, and others, and in part because of the impact of having to suspend vaccinations for a while due to the coronavirus. We also, we've helped with Ebola, we've helped with COVID. In fact, the head of WHO in World Health Organization in Africa said last week that if it wasn't for the polio network, they never would have been ready to respond to the COVID-19 in the manner that they have. This slide, I always debate showing it. In one respect, it's sad because all of the children in these photos got polio. But the other side of the equation is that there's been no child in any of these regions of the world who got polio after these kids. These were the last children who were diagnosed as having wild polio virus in these regions of the world. Europe, this kid, the one in India, Ruchti, I met her a couple of years ago in Calcutta. And nice, sweet young girl. She's doing fine. She doesn't seem to have any lasting impacts, but it's now 10 years. It was January of 2011 when she came down with polio. The girl in the middle, what a sweet, pretty little girl. I haven't met her, probably never will, but she, sadly, she was the last child in Africa. But you look at that smile, she's doing well, and you just think of there were 35, even since we resumed after suspending during COVID, vaccines for a while, we immunized 35 million kids in the last month or two. And, those 35 million kids won't get polio. Yafana Ali did, we pray for her, but I was happy to see her doing well. In our continent, the Americas, this is Luis Furman, the little kid with the red shirt, with a polio worker next to him. This 1991, it's been a long time since we've had a case of wild polio virus in the Americas. Interestingly enough, this was a reunion in 2018, and there's Luis Furman walking towards us under the umbrella, and the man that he's facing is the man that was holding his hand in that picture in 1991. They had a reunion. Luis is doing fine, but you can see he still has some impact from polio, but he's living a life, contributing, doing things, and we're happy that he's doing well. So where were the money spent that you gave last year or the year before, which we spend the next year? A lot of it's getting vaccines, paying the stipends to those community-based workers. It's what they call the cold chain. It's the coolers. It's the transportation systems, everything from rent-a-cars to canoes to even camels at times. But anyway, it's all about delivering the vaccines. This is what funds the national immunization days that we see in different countries. Raising awareness, they call it social mobilization. Those are the radio ads, the TV ads, the billboards, all of the activities that try to convince people to put the polio drops in the mouth. We have health clinics that detect disease. They take the samples, they go to the laboratories that we fund. Surveillance is crucially important in making sure we identify cases early and we begin the immunization activities that we need. And we're also buying vaccines. 20% of the money last year went to vaccines. We expect that to rise a little. Just this past week on October 20th, the trustees of the Rotary Foundation, who take the recommendations from the polio committee, approved grants of $50 million. Again, with monies that you donated, Rotarians around the world. You can see the first 3 bullets, we're still working in Africa. Even though the wild polio virus, it's been certified free, we're still needing to do surveillance. We're still needing to immunize kids. We need to make sure it stays polio free. The worst thing is declare something polio free and then have cases again. Most of the money, though, we're spending is in Afghanistan and Pakistan. And you see, these are all millions of dollars. And this is what's paying for the NIDs. It's paying for the social mobilization. It's what get those drops into the mouths. We're also, this MOPV2 stockpile, you think that's vaccines, 12.3 million. And we're also funding research. It's, there's new innovations all the time. There's a new polio vaccine that's about to come out that will take care of some of what we call vaccine-derived cases. That's supposed to be ready to be approved in the next month or so, and that's doing the job. This woman here, that was in the Philippines in November, and they had an outbreak there of vaccine-derived. You can see Rotarians were hard to work, working with the government, went right to work, and we haven't had a vaccine-derived case there now since January. So what do we need to do? How are we going to get this done? Rotarians will be talking this close, and people wonder, how close are we? We need to continue to advocate to governments of the world. President Holger is here with the Prime Minister of Pakistan. He also met with the Army General, and they have indicated 100% commitment to work with us, to work with the partners to eradicate polio. It's raising of money. It's stopping these vaccine-derived cases, and those aren't, the people who get those aren't getting them who take the vaccine. The ones who get them are ones who take no vaccine. They don't do their routine immunization. Their immunity systems are awry, and unfortunately, when kids that get the vaccine, the live vaccine, the oral one, secrete it, it hits the ground, it mutates slightly, and people that have very low immunity rates pick up that little smidgen, and unfortunately get it. And there's actually more cases of those this year than there are of the wild polio virus. Most of all, it's all about convincing parents. People say, I go to many meetings, and my view is zero in on what the real issue here. The real issue is we need to convince parents and leaders to have their kids receive the oral polio vaccine. Country by country, that's how we've accomplished it. That's how it's done. We've had issues with social media and some politics in Pakistan. That seems to be resolving itself. But we had some setbacks. But in Afghanistan, we've got the Taliban, we've got ISIS, we have areas tribal areas that the government doesn't control. And even though when we can get to houses, there aren't refusals, but in the tribal controlled areas where the government's not involved, the leaders there have banned house-to-house vaccinations. And while Rotary itself doesn't talk with the Taliban, some of our partners do, and it's a tricky situation. We have met, you had 2 or 3 meetings last year, and maybe at the beginning of this year, with the people in the U.S. government who have actually been negotiating with the Taliban in Qatar, Doha, Qatar. And they're very receptive to raising these issues of health security and polio. And we're hopeful that something's going to let loose. But in the end, it is all about convincing the mothers, the fathers, and I'm sorry I put myself in this picture, but someone else took it. But I love this picture, not because I'm in it, because of this woman. And you look at her smile. she came into a health clinic. We were doing a little polio event. I look at it, I do immunizations, but to be honest, they're photo ops. They're, things they arrange for local publicity. Stella and others have actually done NIDs. I do events, but anyway, but we went there and there was the cameras and all that, and they all left. And right as we put the vials back in the refrigerator, and this woman runs in, and all concerned that she was late, and she had left work, gone home and get the baby, and then had come over, and she had just had this baby like a month before. And I want to get my kid immunized. So we got the vials out. I put the 2 drops in, and then someone snapped this picture. And if every mother felt about polio vaccines the way this woman did, we would have ended polio last year or the year before. We need more mothers like this. And to me, this is what it's all about. It's about saving the children, protecting the children. And Rotarians have been at this a long time. We've been patient, although we're anxious. We've been persistent. I imagine we're going to continue to be persistent. But mainly, there are just so many Rotarians in the world who have the passion to get this done. It's people ask, is it a tough job, Mike, to chair the polio effort? Particularly after taking the place of someone like Bob Scott. And my answer to everyone is, it's in many respects, it's one of the easiest jobs in Rotary because there's so many Rotarians who have the passion for polio eradication. It's so important we get this done for the children of the world. It's so important we get this done so that Rotary can move on to other aspirations, other visions, and other dreams. And it's so important to get it done because we made a commitment to the world that Rotary would lead an effort to eradicate polio. So I thank you. It's great to be with you today. I congratulate Governor John on the district conference, on trying the virtual and setting, and that seems to work well. And also wish you all well. I know you're doing a district merger, and those things are never easy. But at the same time, you meet new friends, you meet new people, and I have the honor of knowing many of you from both districts. And those of you that don't know each other, you're going to meet some great new friends. And anyway, thank you. Great to be with you.